Welcome back. Several days ago, your Alaska Link reported that health insurance rates for the year of 2015 would go up by a jaw-dropping 37%. The reason why? Obamacare, at least according to a press release sent out by a state agency. Our government and politics reporter, Gretchen Parsons, taking a closer look into this price hike and joins me now with more. Hi, Gretchen.
Well, hello, Mike Ford. Alaskans weren't exactly pleased to hear the news of rising insurance rates. Some lawmakers in nonpartisan organizations say that there was more the governor's administration could have done to keep prices low, and that the way the information about prices going up was disseminated was downright inappropriate.
There needs to be some responsibility at the top.
When it comes to health insurance, last week, a press release from the Alaska Department of Commerce reported that by January 1st of 2015, health insurance plans that cover 16,000 Alaskans will increase by a staggering 37%, something that Governor Parnell says is a direct result of the Affordable Care Act, or Obamacare, as is stated in the release.
It absolutely seemed like it was more campaign related than actual government related.
For months in the governor's campaign for re-election, Governor Parnell has insisted that the Affordable Care Act does not work for Alaska, causing nonpartisan organizations like the NAACP to wonder if the insurance hike release was campaign-driven.
This press release was done on official state stationery and a state website. And now, granted, it would have been different if it had been literature that was posted by his campaign, but he was using state resources to put his position out there. So it's an impropriety.
Director of Alaska Division of Insurance, Lori Winghire, says that the terms Affordable Care Act and Obamacare are used by consumers and insurance companies synonymously, and the release was not meant to be political in nature.
And for whatever reason, the term Obamacare was used, but it was not meant to make a political statement.
State lawmakers like Senator Bill Wielechowski believe that not only was the release politically driven, but the governor's administration could have prevented the spike.
The governor has created this situation by not accepting Medicaid expansion, which, by the way, would not cost Alaska anything for 5 years.
But the state disagrees.
We think that we're talking two different sets of people. The people that are being impacted right now by these rate increases are not the ones that may have qualified for Medicaid.
Alaska is also a state that does not have public review over insurance rates.
Alaska has one of the least transparent states in the United States in terms of how we review our health insurance rates.
There was an opportunity to have public oversight for the rates that the insurance companies were about to implement or were suggesting to implement, and the governor chose not to require that public oversight.
Winghire says that public hearings on rates would not have an effect on 2015 health insurance rates.
We do not believe that's true either. Alaska statutes contain a provision for confidentiality until the rates actually become effective, and that was done to promote fair competition and so that one insurance company was not able to create a monopoly, knowing what their competition was doing.
Despite what the state says, not all are convinced that the state has done all it could to prevent next year's insurance rates from becoming sky high.
We need to do more for those that have less.
Now, the director of the Division of Insurance did mention that they are encouraging Alaskans to shop